Hi everyone, it's Dr. Wendy Fortna here with a COVID-19 update for Hanna and area. Today is Wednesday, November 18th. As many of you are aware, we are currently still in a very good situation in our area. We have 0 active cases of COVID. Many of you are also aware that our closest neighbors down in Drumheller are not so lucky right now. They are already under additional precautions, and I will tell you that if you are a patient of the Drumheller Medical Clinic, they are not doing standard visits any longer, but doing virtual visits right now through the telephone. Please visit their website for updated information. Right now, the Hanna Medical Clinic is still providing a full range of services and in-person as well as telephone visits, depending on the circumstances of the visit. Should the situation change in Hanna and area, you will see updates on our webpage as well as our Facebook page letting you know about those changes. It's quite concerning right now what's happening both in our province and across the country and even the world right now with the numbers of cases. And I'll remind everyone that even though our lovely little bubble is very well protected right now, many of us have to leave our bubble, whether it be for medical reasons, for appointments, for surgeries, or for personal reasons, or even some recreational reasons. And so we are still very much connected to those around us, and therefore at increased risk. There are not many people who are observing the appropriate rules at times. So please remember to wear those masks if you're going to be less than 6 feet from people, and it's still very important to wash your hands. We've been noticing here at the clinic that some people are not familiar with how to use hand sanitizer properly, and they've asked me to do a little mini demonstration. So what I get you to do when you have your bottle of hand sanitizer is put a full dose into your hand, not a tiny little nibbin. And what you're going to do is wash those hands front and back, in between your fingers, so that the entire hand gets completely damp during the procedure. Depending on the kind of hand sanitizer or the particular brand, it will take longer than others in order for the moisture to fully disappear, but you really want to cover the whole area of the hands thoroughly. This makes sure that any germs that might be on your hands are not going to remain when you come into the offices. We will remind you too, though, that we do clean every patient and physician touched surface between every patient here in our medical clinic to try to keep you and our staff safe. You will notice a few changes that have occurred over the last little while. One of them is up at the Hanna Hospital. We have a front door greeter that is going to be working from 8 in the morning until 8 in the evening. These are the hours that the front doors of the hospital will be opened. This greeter's responsibility is going to be to screen the visitors that are coming in, as well as people who are showing up for laboratory appointments or diagnostic imaging appointments, physio appointments, to make sure that they are negative for the COVID screening criteria and then keeping everybody safe. Please be careful if you have an 8 o'clock appointment and not be dropped off before 8 o'clock, because those front doors aren't going to open until 8 o'clock proper, so be just on time for those ones, okay? As always, the emergency doors are open, but we don't want a lineup of people who are not there for emergency between, say, 7:30 and 8 o'clock, just trying to get in the hospital at that time. Another reminder coming from the hospital, for people who are coming to visit loved ones both in the nursing home as well in acute care, many of you bring up food with you, and it's a wonderful treat for the people who are living or staying in the hospital setting, but you are not allowed to remove your mask and consume food or beverage while you are visiting the hospital. That mask needs to stay on the entire time. If you are found to be eating and not following the appropriate rules, you may be asked to leave, and that would not be kind for your visiting guests. So please make sure you remember food is only for the patients if you are bringing it, not to be consumed by yourselves. You'll have to do that in your vehicle or before you enter that room. The other question they've asked me to comment on a little bit is about questionnaire honesty. So we've had a number of cases over the last couple of weeks of individuals being dishonest when they're answering the COVID screening questions here at the clinic. So these are the questions that ask if you have any particular symptoms, if you have been out of the country, if you have been in contact with people who have these symptoms. Please know that we are still going to see you for your visit if you answer yes to any of those questions, but you will be seen in a different room here in our medical clinic, still by your family physician. And when you go into this separate room, we have a minimum amount of equipment in there so that there's less cleaning requirements afterwards. When your physician comes to see you, they'll be wearing a full protective set of equipment. So they'll have on their mask, their goggles, they'll have on a special gown and some gloves. And this is to make sure that if you do have COVID disease, we are able to keep the remainder of our staff and patients safe And after you leave, the room receives a very thorough cleaning before it's used again. So if you can please answer honestly, I guarantee you'll still be seen. It just helps to protect everyone. And this would hold true for any screening questionnaire at hospital, at hockey, at dance. It's so important for you to be honest with these to continue to protect our community. I've been asked a few times lately, can I work from home right now? Is it the best choice for me? And I really can't tell you the answer for that. I think that given the situation across the province, every company needs to have a very good policy about how employees can return to working from home again, and a distinction between who is necessary to be at work and who could safely be at home, and be able to make that transition very quickly. If we see cases rise or have a particular outbreak in our community, we'll be wanting to work from home as much as possible. As I've said, you'll be able to look on our Facebook page for the Hanna Medical Clinic or on our website in order to get updated information if our clinic has to revert to a different type of visit style, such as all over the phone. We would also contact every booked patient if that was the case, so that they knew what their appointment type was going to be. So definitely, employers out there, please make sure you have a clear policy for people to work from home. And similarly, have a clear policy of supports in place for your staff members who have to be at home because of symptoms or because of sick loved ones. We really want to make sure that those sick people are staying at home with their illnesses and recovering there, rather than spreading even minor illnesses like coughs and colds to their coworkers. I think that's all I have for now. Continue to stay well and be safe, and we'll be in touch.